continue on and do the lower extremity. All right. Okay. Here is the upper extremity. We're going to start off and discuss the pectoral girdle. And we know the bones that make up the pectoral girdle are going to include the clavicle and the scapula. So here's your clavicle. Okay, it's this nice S-shaped bone, one end that articulates with the sternum, specifically the manubrium. That is going to be referred to as the sternal end. Easy way to remember that is that end looks like it's more pyramidal or triangular. Okay, whereas the other end that articulates with the acromial process or the acromium, we call that the acromial end. And that end is going to be more flat, broad, okay, like a spoon. So you'll notice this little bump here. That's actually going to be the inferior surface where that bump is located. And that's called the conoid tubercle. That's really the only bony landmark that we're requiring you to know for the exam, okay, on the clavicles. The conoid tubercle, please pay special close attention to the conoid tubercle, the spelling of it, I mean. I don't want you to confuse it with other structures. So we're looking now at the scapula. Our scapula is going to be a flattened bone. It's a triangular shaped bone. It sits on the superior lateral portion of your thoracic, of your thorax, I should say. All right, and you're noticing here, I'm showing you two views, the posterior view and the anterior view. Okay, your posterior view is you can see this structure here, that's the spine. The anterior view is pretty flat. So this is the part that sits against your ribs, and this is the part that I see when I'm standing behind you in line. All right, so this portion of the scapula referred to as the body of the scapula. That's the body of the scapula. If we flip the scapula over, we're looking at it from the posterior side. That top edge there is the superior border. The scapula has three borders. The top one is the superior border. Here you can see it from the anterior view. I want you to be familiar with the anterior view and the posterior view. All right, back to the posterior view. This is the medial border. Medial border is going to be the border that's closest to the spine. And then you can see it over here on our anterior view. Okay, and then the final border is the lateral border. This is going to be the border that is closest to the axilla or the armpit there. And here it is from the anterior view. All right, so I want you to be familiar with all these different views here that you're seeing, right, and where the borders are in relation to what view you're looking at. So back to our posterior view of the scapula here, you can see that raised prominent structure. That is the spine of the scapula. And where it ends there, you have what's known as the acromium, also known as the acromial process. And that structure is going to articulate with the clavicle and will form the acromioclavicular joint. All right. You'll see this is the acromium from the anterior view there. The acromium is going to be more of a posterior structure on the scapula there. Now, this is a lateral view. You should be familiar with this. So our lateral view, you can see to our left, this is the anterior side. And then to our right, this is the posterior side. So you can see how the acromium is more posterior. So we talked about last class how there are depressions or areas on the scapula. And in these depressions and areas, we're going to find muscles. So this first one that we're looking at is the supraspinous fossa. that sits above the spine of the scapula. Your supraspinatus muscle will sit there. Below the spine is the infraspinous fossa. And that's where the infraspinatus muscle will sit. These are parts of these are muscles that make up your rotator cuff. Don't worry about knowing those yet. We'll talk more about those when we get to the muscles. And then we look at the anterior surface of our scapula, and we'll see the subscapular fossa. And that's where subscapularis muscle is going to sit. Now, again, we're looking at the lateral view. This is the anterior part, and you'll see another process on the scapula. This one's coming anteriorly, and so this one's known as the coracoid process. The coracoid process. It's a site for muscle attachment. Here you can see it on the anterior view. It's outlined and highlighted by the black dotted line there. Okay, coracoid process. And then our last fossa or cavity on the scapula is the glenoid fossa. This structure, when it articulates with your humerus, is going to make your glenohumeral joint, also known as your shoulder joint. Here you can see it from the anterior view. That's the glenoid fossa or the glenoid cavity. All right, so that's it for the pectoral girdle there. Now we're going to move in to the upper extremity. And the upper extremity has several different areas. All right, the first area that we're going to talk about is going to be your brachium or your arm. And so the humerus occupies that area. There's only one bone in the brachium, and that's the humerus. So it's a long bone. So it has epiphysi on it. You have a proximal epiphysis and a distal epiphysis. Well, the proximal epiphysis, the arrow is pointing to the head. Okay, that is one of the structures here on the proximal epiphysis. That is the head, a rounded, smooth area. Then, okay, you're noticing that structure that's highlighted by that black line. That's the anatomical neck. That's where you will see the epiphyseal plate. Epiphyseal plate is where the closure of our growth plate occurred. So that's the anatomical neck. This, where we see the actual tapering down or the slimming down of the bone, that's the surgical neck. That's a common fracture site. Please know the difference, and please specify when you're referring to the neck, whether it's the surgical neck or the anatomical neck. You can't just put neck. You won't get full credit. Now, lateral to the head of the humerus is the greater tubercle. That's this larger bump over here. That is the greater tubercle. Now, if we go more medial, it's tough to see on our model here, but this is the lesser tubercle right here. Greater tubercle is more lateral. The lesser tubercle is more medial. So we're looking at a long bone here. Whoops, I don't want that. Hold on. All right, we're looking at a long bone here. And our long bone that we're looking at is the humerus. Okay, and so keep in mind, whenever you're looking at a long bone for your exams, it's helpful to figure out which end is the proximal end and which end is the distal end, because then when you learn the structures, you'll know which structures are proximal and which ones are distal. But also, you need to know which side of the bone is the lateral side and which is the medial side. What is the posterior view? What is the anterior view? Okay, so when we're looking at these right now, we're looking at the humerus, and this is the anterior view. So this is the front of the bone here. And it's the medial, where the arrow is pointing, that's the medial side of the bone. The head of the humerus is going to be on the medial side of the bone because it's going to articulate with the scapula. Here's your funny bone. You remember that? It's the medial epicondyle. That's that big bone on, or that bump on the inside of your elbow. Okay, so you should know these structures are on the medial side. That'll help when you're trying to figure out where certain things are located on the bone there. So in between the two tubercles, you have a groove there. A couple different names for those. We call it the intertubercular groove, the bicipital groove, or the intertubercular sulcus. So 3 different ones that you can use. And the tendon for the long head of the biceps brachii muscle sits right in that groove there. It's the intertubercular groove. Then if we go down the shaft a little bit on the bone, or the diaphysis, excuse me, there's a bump. And again, it's tough to see on this picture, okay, but you'll have this bump. And your deltoid muscle attaches onto that bump. So therefore, we call it the deltoid tuberosity. All right, now we're down at the distal end of the humerus. This is an anterior view. We're looking at the front. So you've got this rounded ball-like structure that is the capitulum. The capitulum. The radius, which is one of 2 bones in your forearm, articulates with the capitulum. Right next to it is the trochlea. This is that bow tie looking structure that I was telling you about. I'll try to outline it there a little bit for you. That's the trochlea. And then next to it is this ball structure, and that's the capitulum. Okay, so the trochlea down here at the proximal end, anterior. Now that big bump on the medial side of the bone, that is the medial epicondyle. The ulnar nerve runs behind that. So when you bang that, you have that weird sensation, and people say, I hit my funny bone. Okay, that's the medial epicondyle. Now, what we've done is we've just flipped the bone over. This is the medial epicondyle when we're looking at it from the posterior view. We flip the bone over. So if you notice, you've got this big, we're going to talk about this structure in a second, but you got this big kind of hole in the back. We go back to the other view, you don't have that. You got 2 smaller holes. You've got one here, and a really small one over here. Okay, so you see that's that hole, which I'll say in a second, is on the back side of the bone. Now we're back to the anterior view. This is the lateral epicondyle. It's much smaller. You don't see it as pronounced. Epicondyles are sites for muscular attachment. And there's the lateral epicondyle on the posterior view. Lateral epicondyle. All right. Then we go back to the anterior view. Just above the trochlea, you've got a fossa there. That's the coronoid fossa. The coronoid process is going to actually approximate and move into the coronoid fossa when you flex your elbow. And we'll see the coronoid process in a moment. Okay, so that's a little bit of a depression right above the trochlea. Then we flip the bone over on the back side, and this is the olecranon fossa. And that is going to allow the olecranon process, or part of the olecranon process, right? When you completely extend your elbow out, that allows the olecranon process to move into that space there so you can fully extend your elbow out. All right, so let's get into the next region of the upper extremity. We've got the forearm, or the antebrachium. There's 2 bones there. Okay, we have the ulna and the radius. We're going to start with the ulna. It's the longer of 2 bones. And when you're in the anatomical position, it's the medial bone. So at the end here, that's the proximal end. That's going to help make up your elbow. Okay, the olecranon process, you can see right there, If you feel at the back of your elbow bone there, that's what you're feeling. You're feeling the olecranon process. So then you've got this kind of notch structure here, like a bite out of the bone. That's the trochlear notch. So that part of the ulna is going to articulate with the trochlea here, with that. So it's going to wrap around it. Wrap around. Okay, that's the trochlear notch. You can see the trochlear notch better. So the trochlea will sit in it like that. And that's a hinge joint, which we'll talk about what kind of the joints in lecture next week. Okay, so just below the trochlear notch is the coronoid process. So it's that little process there, and when you flex and bend your elbow, it moves into the coronoid fossa. So it doesn't bang into the bone there. Coronoid process. There you can see it on the anterior view here. And then you can see the radial notch because the head of the radius is going to brush up against that bone there, and it kind of nestles in there nicely. So that right there is the radial notch. All right, going down to the distal end of the ulna, okay, that's where the head's going to be, but you'll see that little nub in there. That's our styloid process. So if you feel your wrist, and on either side of your wrist, you'll feel these bones sticking out slightly. All right, if you're on the medial side by your pinky, that's what you're feeling. That's the styloid process. All right, let's look at the second bone of your forearm. That's the radius. The head of the radius is on the proximal end there. You can see it looks like a disc. And then just below that is the radial neck, or the neck of the radius. And then you'll see a bump right below that, and that's the radial tuberosity. That's where your biceps tendon inserts onto the radius. It's a good anatomical landmark. Get familiar with that one. Okay. Then down to the distal end, right? You're going to see that little nubbin hanging out there. That's the styloid process. So that's that bump that you feel on the lateral side of your wrist, the base of your thumb there. And then you've got a little depression there, and that's the ulnar notch. That's where the ulna is going to kind of nestle in and articulate with the radius. Okay, so on to the next part, the wrist. We're going to talk about the carpal bones. There are 8 carpal bones. So we're going to start with the proximal row, and then we're going to move into the distal row. So we're going to go lateral to medial. So we start on the thumb side. So the first bone in the carpal in the proximal row is the scaphoid. Then right next to it is the lunate. The lunate. Now it's tough to see here. Okay, but the lunate, that's where the lunate ends, right there. That's the lunate, to the right of that red line there. And then you have the triquetrum. That's pretty much this whole bone here. Okay, that's the triquetrum. And then the pisiform is this little bone that looks like a pebble. That's this guy right here. And it sits right on top of the triquetrum. Scaphoid, lunate, triquetrum, pisiform. Those are the first 4 carpal bones that are in the proximal row. Okay, now we're going to go to the distal row. The distal row of the carpals, they all articulate with a metacarpal bone. Metacarpal bones are the bones that make up your palm. So the first one is the trapezium. I always remember trapezium Okay, that rhymes with thumb. Okay, so the trapezium is at the base of the thumb. So trapezium articulates with metacarpal number 1. Trapezoid articulates with metacarpal number 2. Capitate articulates with metacarpal number 3. And then our final carpal bone is the hamate. And that articulates with metacarpals 4 and 5. 4 and 5. So those are the 4 carpal bones in the distal row. Now the rest is easy peasy. Remember, there's 5 metacarpals. You have 5 fingers. We label the metacarpals using Roman numerals. So, all right. So each digit, we start with a thumb. Thumb is always number 1, metacarpal 1. Index finger is metacarpal number 2. Your middle finger is metacarpal number 3. Metacarpal number 4 is your ring finger. And metacarpal 5 is pinky. That's simple. Should not lose any points on this. We shouldn't really lose any points on any of it. Okay, but metacarpals are easy. Phalanges, same thing. All right, you have 14 phalanges. Every single digit has a proximal phalange. Every single digit has a distal phalange. But only digits 2, 3, 4, and 5, that would be these right here. Only those 4 digits have a middle phalange. Now you can call it a phalange or you can call it a phalanx. I don't care. You have to use the Roman numerals again, right? So your thumb is Roman numeral number 1, whereas the pinky is Roman numeral number 5. All right. So there's the distal phalanx. I'll let you fill in the rest because I know you can do it. Proximal phalanx 2, middle phalanx 2, distal phalanx 2. And then the same goes for the rest. Okay, so this would be proximal phalanx 3, and then so forth and so on, all the way up. So you can fill those out. Okay, that's it for the labeling of the upper extremity. Hoorah, good job. Let's go. Whoops, why did I do that? Okay. All right, let's talk about the pelvis. Get into the pelvic girdle a little bit, and we'll talk about some of the bones of the lower extremity now. Now we're going to move on to the lower extremity. And so we're going to get into the pelvic girdle a little bit, what the pelvis is, what the pelvic girdle is, because there's a difference. All right, the pelvis is made up of 4 bones. 4 bones. We've learned of 2 of them. All right, the sacrum and the coccyx, and then both your hip bones, also known as your left and right os coxa. And so this is going to make up the pelvic cavity. All right, the pelvis helps make up the pelvic cavity that holds all of the viscera. Some of your internal reproductive organs, some of your digestive organs, some of your urinary tract organs will be found here in the pelvis. But when we talk about the pelvic girdle, we are only talking about the left and right os coxa. Remember we talked about the pectoral girdle? The pectoral girdle holds the upper extremity to the trunk. All right, well, the pelvic girdle holds the lower extremity to your trunk. So there's a difference between pelvis and pelvic girdle. So you need to know that. Okay, so here's a picture of the pelvis. All 4 bones are seen here. Your sacrum that sits below L5 that you can see there. And then the coccyx sits at the bottom of the sacrum. And then on either side of the sacrum is your left and right, left os coxa. And all those make up the pelvis. So you can see here, and I'm going to tell you this right now. Take a look at this. Really take a look at this picture. because I guarantee you that every single one of you will have at least one question that asks you to tell me if it's a male or female pelvis to which you are looking at. Because there's certain differences in the male and female pelvis. Okay? If you look, the distance from here to here is much wider in the female than it is from here to here in the male. That's because of baby. Also, we have this angle here is larger than this little angle here in the male. It's called the subpubic angle. And then the opening here, pelvic brim, compared to the male here, males is smaller than the females, again, to help facilitate childbirth. All right, so a lot of these differences are based on childbirth, all right, functions for childbirth. So let's talk about the os coxa then. That is your hip bone. And so there's a couple different names for it, and we'll go through those as we're going over the skeleton here. All right, but your hip bone or your os coxa is actually made up of 3 bones that will eventually fuse. It is important that you know all 3 of these bones, the ilium, the ischium, and the pubis. So again, because these bones fuse, we are able to determine the age of a skeleton, because if you find a skeleton and none of these bones have fused, then you know that this is a relatively young, probably preteen. And then if it's after your teenage years, okay, or even in your late teens, 17, 18, okay, and it's fused, right, you'll be able to tell with a broad guesstimation. So the os coxa, when they articulate with the sacrum, are going to form your sacral iliac joint. So here's a picture of all 3 bones of the os coxa. So you notice the ilium makes up about the superior half of the os coxa. Then you have the ischium and the pubis. The pubis is going to be more anterior. Your ischium is going to be more posterior and inferior. You're actually sitting on your ischium right now. Those bones in your butt that are against your chair, or if you're lying in bed, right, that is going to be found on your ischium. Here you can see the different bones on the anterior views. Okay, so a couple structures that we've noted on the os coxa. Right, when we're looking at the lateral side of the os coxa, you cannot help but notice this big cup sitting there. And that cup we call the acetabulum. And that's where the head of the femur is going to articulate to make up your hip joint there. Okay, so this is a ball and socket joint that you're going to see. So the acetabulum, is the socket, the cup there. And inside of that cup, all bones of the ilium, the ischium, and the pubis, they all fuse together in there. And you'll see on the internal surface there what looks like a crescent moon. That is what we call the lunate surface. It's nice and smooth, and that's where the femoral head is going to articulate. So here you can see the acetabulum. Right here, that's the cup. And then the lunate surface is this smooth area here, and that's going to be the part of the acetabulum that's going to articulate with the head of the femur to make our femoral acetabular joint, or your hip joint. All right, so let's talk about the 3 bones here, starting with the ilium. Okay, this is the largest of the 3. All right, so it's going to make up that fan-shaped area, all right, that you saw in our pictures here. This is that big fan-shaped area, the ala. All right, so you're going to see on the ilium, there's several different landmarks. You're only going to be required to know a few of them. So the iliac crests. So if anyone's ever asked you, all right, hey, you, put your hands on your hips, okay? And if you put your hands on your hips, normally you're putting your hands against the iliac crest. The iliac crest is that top ridge there to your hip. And so you have a couple structures that are on the front of that ridge and the back of the ridge. And two of these bold-faced ones you have to know. You have to know the anterior superior iliac spine and then the posterior superior iliac spine. So let me show you in a moment. All right. On the medial side here of the ilium, you're going to have a structure called the iliac fossa, right? And that is going to be, right, where we'll see some gluteal muscles attach onto, some of the muscles of your rear end. And then we'll also see an auricular surface there, and that is going to articulate with the sacrum to make your sacroiliac joints. So here's the iliac fossa right here. Then we have our auricular surface that's going to articulate with the sacrum to make the sacroiliac joint. And then you can see here you have the iliac crest, and on the front you'll have this little bump here, and we call that the anterior superior iliac spine. And we go all the way to the back, and we'll feel this. You'll see this bigger bump there, and that's the posterior superior iliac spine. And if you've ever felt your back, you'll notice two little bones on either side of your spine in your lumbar region of your vertebral column. And those little bones, you'll feel them. Those are the posterior superior iliac spine. Okay, that's part of your hip bone. All right, we also have this indention structure here called the greater sciatic notch. That is where your sciatic nerve will exit out from your pelvis and start to go down the posterior part of your glutes and your leg. And then you've got the ischial spine right here. That's that little bump there. And then we have a smaller notch right below the ischial spine, and that's called the lesser sciatic notch. Here's a great picture of the sacroiliac joints. All right. Next is our ischium. This is the more posterior, all right, how would I say that? It's inferior to the ilium and posterior to the pubis. Okay, so on this bone here, we have the ischial spine, the lesser sciatic notch. One of my favorites, the ischial tuberosity, which is that bone that I was telling you that you're sitting on right now. It's called the sits bone, but I don't really refer to it as that. But the ischial tuberosity, yes, you're literally sitting on that, and that's in a weight-bearing position, but your hamstring muscles attach onto the ischial tuberosity. All right, and then as we start to extend the ischium towards the pubis, or the pubic bone, right, that part of the ischium that extends toward the pubis, right, is called the ischial ramus. All right, so here you can see, all right, the ischium. Okay. And then you have the ischial spine here, that little bump that's right below the greater sciatic notch. And then just below the ischial spine, this little notch here, that's the lesser sciatic notch. And then this structure where you're sitting on right now, that's the ischial tuberosity. And then where the ischium starts to extend towards the pubis here, this little spot right there, below this hole here, that's the ischial ramus. All right, our final bone is the pubis bone, okay, or some people refer to it as the pubic bone. And so in the pubis, you're going to see a big hole, which we refer to as the obturator foramen. Right, we'll have some dense connective tissue that's located there. And then we'll have, all right, these two long portions of the bone called the inferior and the superior pubic ramus. And so these parts will come around and wrap over towards the front. The one that goes above the obturator foramen is obviously going to be the superior pubic ramus. The one that's below it is the inferior pubic ramus. So here, let's show you. Here's the obturator foramen right here. Okay, so the part of our pubis that goes above or superior to the obturator foramen, that's the superior pubic ramus. You can see it right here. And the part that's below it, that's the inferior pubic ramus. And you'll see this one structure. Remember, we were talking about the pubic symphysis, and that's where your left and right os coxa come together and articulate with one another. And there's a disc of fibrocartilage that sits in between. Okay, where the fibrocartilage disc sits, we call that the symphyseal surface. Symphyseal surface there. All right, so what are the three bones that fuse to form the os coxa? The ilium, the ischium, and the pubic or pubis. All right. Okay, so just to kind of reiterate in words what I was telling you folks about the pelvis and how we're able to tell the difference between a male and a female pelvis, right? Again, we call that sexual dimorphism, being able to look at bones and tell the gender of the sex of the skeleton, right? Keep in mind, right? Women, this is how nature has decided to go with, but women's pelvis is supposed to be designed for pregnancy and childbirth. So we talked about how the hip bones are more flared on the female pelvis. That'll give a wider pelvis, but also, and I didn't mention this before, but the female pelvis is more shallow than the male pelvis, which makes sense because you got to push the baby out. You don't want to push the baby out 12 inches when you could push the baby out 6 to 8 inches. Okay, so it's going to be shallower. All right, we'll also see on the female, the acetabulum is going to be more lateral. Right, that's why women have one of the reasons why women have a better center of gravity. And we also notice that this greater sciatic notch will be larger. I pointed out the subpubic angle. Okay, that's again where both the pubic bones, all right, will articulate with one another, and that subpubic angle is going to be much larger, all right, in women. So here you can see the big difference between male and females here. All right, this is that subpubic angle right here. It's much wider, much more convex than the male. How do male and female pelvises differ with respect to the shape of the pubis, subpubic angle, greater sciatic notch, and overall shape of the pelvis? In females, the pubis is longer, almost rectangular. Subpubic angle is wider and more convex. Greater sciatic notch is wider, and the pelvis is shallower and wider. All right, so I want to finish up today's lecture by just talking about the bones of the lower limb. We're going to go over the femur, and then that's it. We'll stop with the femur for today. But when we're talking about the components of our lower extremity, okay, leg just doesn't cut it. Yes, a lot of us refer to our leg as our lower extremity, but we can't do that anymore. Right, so when we're talking about the components of the lower limb, when you say leg, I'm thinking of that part of your lower extremity from your knee to your foot. That's what I'm thinking. Okay, the thigh is going to be from your hip to your knee. Then obviously your foot's going to be your foot. So the bones of the lower limb are similar to the bones of the upper limb, except there's a couple differences. Okay, you have the femur, which is going to be in the proximal portion of your lower limb in the thigh. That's one bone. Well, the humerus was in the brachium, so that was also one bone. Okay, then in your forearm, you had 2 bones. Well, in your leg, you also have 2 bones. In your wrist, you had 8 bones. Okay, but in your foot, and part of your foot, okay, around your ankle, you have 7 tarsal bones. But if you notice, the metatarsal and phalange numbers are the same. You had 5 metacarpals in your hand. Well, you have 5 metatarsals in your foot. And then you have the same number of phalanges. So guess what? It's going to be the same pattern then. Okay, your big toe, the hallux, only has 2 phalanges. The rest of them have 3. We'll get into all that. Oh, and also, we've got the largest sesamoid bone in the body, your kneecap, the patella. Okay, a lot of similarities, a few differences. Right, so here we're looking at the bones of the lower limb. So we're going to start off with the femur, longest, strongest bone in your body. Okay, so the proximal end of the femur will contain the head. Now it's interesting because the head, all right, comes off the neck, which is angled from the diaphysis of the bone. Well, on the head, you have a small impression. All right, so here's the head of the femur. Okay, and at one point, you have this small indentation there. So I guess if I was looking at it from the right angle, it would look something like this. Okay, that's pretty dramatic, but you get the point. So it's a tiny depression, and there's actually a ligament that comes out of that depression. It's called the fovea, also known as the fovea centralis. It comes right out of that, and it'll attach into the acetabulum. So it literally holds, well, it helps to hold the femur in the joint, in the hip joint there. All right, then off the bone, off the head, we have the neck, right, and it's angled. Okay, close to about 45 degrees. Then if you feel on the lateral portion of your legs, you have this bone there. That's the greater trochanter. That's on the opposite side of the head. And then you also have the lesser trochanter. It's a smaller bump. It's going to be on the medial portion of your femur. Okay, so these trochanters, they're sites for muscle attachment. Okay, so therefore you're going to see quite a large projection or number of muscles on that greater trochanter there. All right, I'm not going to worry about these structures here because you don't need to know them for your test. So I want to move down now to the distal portion of the femur and talk about a couple of the structures that you're going to see down there. All right, so you got your medial and lateral condyles, and you also have your medial and lateral epicondyles. Remember what I said about epicondyles. Epicondyles are sites for muscular attachment. And when you look at the word epicondyle, epi is above. So these medial and lateral epicondyles are going to be above your medial and lateral condyles. The condyles are these huge, large, rounded surfaces. If we look here, you can see them nicely down here, here, and here. Big rounded surfaces that are going to make up or partially make up your knee joint. And so they're going to articulate with the top of the tibia. And so there's a small space in between the medial and lateral the medial and lateral condyles, and we call that the intercondylar fossa. Okay, so you can see that down here. There's your intercondylar fossa in between your 2 condyles. Always keep in mind when you're looking at the bone here, right, especially if it's a long bone, which is the medial side, which is the lateral side, which is the proximal end, which is the distal end. Look at the head here. The head is always on the medial side of the bone because it has to articulate with the hip. That means the greater trochanter is on the lateral side. So when you're taking a test and the arrow is pointing to this structure right here, you've got to figure out, well, am I medial or lateral? Right, because I know it's a condyle, I just don't know which one. So you look up, you say, oh, I'm on the same side as the head. The head is medial, so this must be the medial condyle. All right, this one over here would be the lateral condyle. You should know these things just to kind of have an idea. All right, let's just talk about the patella, and then we'll end class here, because for whatever reason tonight I have a raging headache. All right, the patella, largest sesamoid bone in the body. That means that it's housed within a tendon. We call it the kneecap. You will no longer call it the kneecap. You will call it the patella. All right, and so it does a couple things. One, it helps to allow the movement of your knee, all right, to be more efficient because of the way that the tendon attaches onto the patella there, all right, and it also helps to protect the knee joint. So again, you should only be able to identify the bone, okay? You don't need to identify the different parts of the bone, the base, the apex, none of that, just that it's the patella. All right, I'm going to stop here today because we are doing great on time.